Well, I'm joined now by Dr Nick Maynard, a British surgeon who's been working in Nasser Hospital. I mean, Doctor, these images are just unbearable. They really are. And you were there for 4 weeks. You recognise some of these children.
Yeah, it's difficult to respond because some of those children I was with last week, Huda, that girl, little boy Omar, I was with them. I was talking to his aunt who was looking after him. I saw them several times when I visited the paediatric intensive care unit. Very, very distressing seeing those scenes.
Just talk us through what we're hearing from Israeli officials when they say they don't identify famine. What have you seen?
Famine. I mean, I've seen profound malnutrition. This is my third visit to Gaza since October the 7th, 2023. On my previous visits, I've called this out. When I've got back, I said, listen, there is severe malnutrition there. It's going to get worse. It is appalling now. I've seen many people die of malnutrition. As I said, I'd visited the paediatric intensive care unit a lot because I had a child I'd operated on there who was on intensive care for a lot of the time I was there. I saw those children. I saw children who then died. And there is virtually no feed being allowed in for them. That story about the American doctor talking about the formula feeds being refused entry is true. I met several doctors who had formula feed cartons of them in their luggage. They were all confiscated by the Israeli border guards, specifically those. Nothing else confiscated, just the formula feed. And there are babies dying. There are 4 premature babies who died in the first 2 weeks when I was in Gaza, in Nasser Hospital. And there'll be many, many more deaths unless the Israelis allow proper food to get in there and nutrition.
And these reports that many of these patients are being kept alive with sugar and water, is that what you were doing as well?
Yeah, well, so the first week I was there, I visited the paediatric unit, and there were, I think, virtually all the children on the paediatric intensive care unit then were being fed with 10% dextrose, which, as you say, is sugar water. There's no nutritional value at all. No formula feed's been allowed in. They've got a small amount of formula feed for the very small babies, but not enough. So they're all being given an inadequate amounts just to make sure some get them. One of the NGOs managed to bring in some feed whilst I was there, so they're distributing that to the children there. But when that runs out, there'll be no food at all. And for the adult patients I was treating, there was no nutritional support at all.
You're at Nasser Hospital, and we know that many of these hospitals, Nasser, for example, is one of the last remaining. We just want to show our viewers the images that you captured from the hospital, where it's virtually become a front line itself.
Yeah, so Nasser's, it's in the red zone, so it's surrounded by the Israeli military. Most of the time they were probably a kilometre or a little bit more away. But for 3 days, about 2 or 3 weeks ago, they came within a few hundred metres of the hospital, and it was extremely tense. We were hearing the bombings, the machine gun fire, non-stop all night. Many staff left because they found it too dangerous to stay there. Patients were discharging. One patient I'd done major abdominal surgery on 12 hours previously. He left the hospital after 12 hours, and I tried to persuade him to stay, but he said, it is safer for me in my tent in Al-Mawasi, and we know that's not a safe area. He said, it's safer for me there than it is in this hospital.
And your colleagues, we're hearing, a lot of the staff who are working there are suffering from starvation themselves, that many of them are queuing up for the kind of food that they are treating patients for.
Absolutely. I've been to Gaza many times, so I saw some people I'd known for years, some of them. I didn't recognise some of them. 2 colleagues of mine had lost 20 and 30 kilograms respectively. They were shells of what they'd been like before. They are all hungry, and they're coming into work every day, but they're then going home to their tents where they have no food. They are going. One anaesthetist I know, in between operations, was going to the food distribution points to get food for his family, and witnessing the horrors there, witnessing the young teenage males being shot by the Israeli soldiers, and seeing how chaotic that food distribution system is.
Well, it's been described by the UN and others as a death trap. Those who have been there have described the situation there where, you know, the soldiers are opening fire on the civilians queuing up.
And I operate on many of those children. I saw young teenage boys, sometimes as young as 11, 12, 13, who had been shot at these food distribution points. They had gone there to get food for their starving families, and they were being shot. And I operate on many of them. One 12-year-old boy died on the operating table when we were operating because his injuries were so severe. And what was even more distressing was the pattern of injuries that we saw, the clustering of injuries to particular body parts on certain days. So one day they'd be coming in predominantly with gunshot wounds to the head or the neck, another day to the chest, another day to the abdomen. And I operated one day on half a dozen young boys, all of whom had severe abdominal injuries. One day, 12 days ago, 4 young teenage boys came in, all of whom had been shot in the testicles, and deliberately so. And this is not coincidental. The clustering was far, far too obvious to be coincidental. And it seemed to us like this was almost like a game of target practice. We're going to shoot the head today, tomorrow it'll be the chest, the next day it'll be the testicles. I would never have believed this possible unless I'd witnessed this with my own eyes.
And when these patients come to the hospital, you don't have the tools or the equipment really to operate in the way that you normally would.
Yeah, I think that's the point. And we clearly do operate on them, and we have to make do with the equipment we have. But there are not enough drugs, so the anaesthetists are using often much less than the normal dose of anaesthetic they use. We are always at risk of running out of gauze swabs. We sometimes don't have sterile drapes to create a sterile operating field. The instruments are often not functioning properly. And you make do, but when you're doing particularly complex surgery, and there was one case, a little 11-year-old girl who had a severe explosive injury which destroyed the bottom part of her esophagus. And that's my main specialty, esophageal surgery. So I had to reconstruct her esophagus and spent most of one night doing it with none of the right instruments, really inadequate instruments, which made it far, far more challenging.
Doctor, this is your third trip to Gaza since October the 7th and when the war began. Why do you keep going back?
Golly, that's I've been going to Gaza for 15 years. I have friends, colleagues there whom I love very dearly, very close friends, people I would call family. So it's very, very personal. My wife and I have Inas, who's what we call her our adoptive Gazan daughter. I taught her as a medical student in Gaza years ago. She got a scholarship to get out, and she stayed in England. She's now a qualified doctor, but she couldn't go back to Gaza to see her family. So I used to go and see her family, would give messages, and she's become a member of our family. So it's very, very personal for me. But the other thing is that I think what is being done to the Gazan people is so profoundly wrong, so profoundly unjust, and it's being allowed to happen by the majority of the world. And I feel this overriding need to help them.
Well, Doctor, we're so grateful for your time. Thank you so much for the work that you and your colleagues do and for joining us.
Thank you very much indeed for asking me.